In this video, we'll discuss all the history questions we need to ask before performing our physical assessment of our patient. We'll start first with all of the questions related to eating. So of course, we need to ask about appetite. Does our patient feel hungry? How often? Are they having any weight loss? Do they have any weight gain? What's the time period there? If they have no appetite at all, we use the word anorexia. They don't want to eat. Just don't get confused with the eating disorder there, which is anorexia nervosa. The word anorexia by itself just means lack of appetite. We'll ask about any swallowing issues. Remember, the medical term for difficulty swallowing is dysphagia. And then we'll ask about any allergies or intolerances. Generally, the distinction there is that an intolerance might cause unpleasant symptoms like bloating or diarrhea or heartburn, while an allergy is the true hives, itching, difficulty breathing, anaphylactic sort of reaction. Finally, we want to know what our patient eats, so we'll do an informal nutritional assessment. If you want to know more about a full nutritional assessment, that's actually a complete chapter in your textbook, chapter 11, that we don't cover in detail, but you are welcome to check it out on your own. Mostly, we just want to make sure that people are getting some of each of the basic food groups, some protein, carbohydrates, and healthy fats, minimizing things like sodium and sugar, and minimizing processed foods. Another aspect you can include in the nutritional assessment is where and how your client gets their food. In some areas, especially of more urban cities, there can be what we call food deserts, where there's no grocery store within several miles. So because some low-income families don't have a car, rely on public transportation or walking, it can mean that getting those fresh, healthy foods is quite difficult, and instead that family may rely on something like fast food or a mini mart at a gas station. Next, let's talk about some of the most common symptoms that people report when they present for evaluation of an abdominal issue. The first one, of course, is pain. And you already know how to do a complete pain assessment, so don't forget your old cart, your PQRSTU. An important piece of that evaluation here really now becomes the quality of that pain. Is it burning down the middle of the chest? Okay, maybe it's heartburn. Is it a crampy feeling in the pelvic area on a young woman? Maybe it's the first menstrual cramp she's ever experienced. So in this case, in the abdomen, there really are many, many different types and causes of pain, so we really need to be very detailed in our assessment. Of course, another common complaint is nausea or vomiting. As you explore that symptom with your patient, make sure you get into the pattern, the duration, and then if there are any contributing factors. Did it start after they ate something funny? Does it happen worse at any one time of day? Maybe when they first wake up in the morning? Have they traveled anywhere new recently? Is there any blood in what they're throwing up? Get all of that symptom analysis so that we can start to put together our clues. Along with that, we'll ask about bowel habits. A lot of times nausea and vomiting is accompanied by diarrhea. So again, the same sort of questions. What's the pattern? Do you notice any blood in your stool? Or of course, so that's diarrhea. The opposite problem could be happening, constipation. So again, just asking how often does a person move their bowels? Do they have any pain or straining when they go? If they ever notice black tarry stools? Do they ever take any medications for constipation? And most patients are really quite ready to tell you about any concerns they have. If your patient does complain of pain, it's important to remember that a lot of abdominal pain is actually referred pain. So you can see in this chart, and this is page 570 in your textbook, that heart pain and reflux pain can be commonly confused. Right-sided shoulder pain may actually be liver pain. Back pain may actually be pancreatitis. So you can refer back to this chart if you suspect that it may not be musculoskeletal, but rather a deeper abdominal pain. Okay, the last set of the history questions here that we want to discuss with our patient are about their past medical history. So of course, do they have any known GI history, whether it's injury, surgery, medical conditions, chronic conditions, any imaging, what were the results of that imaging? We can also take this time to ask about any kind of family history of those same sort of conditions. And then, of course, are they taking any medications at this point? Now, we want to know any medications, not just GI medications, because many medications have some sort of GI side effect, whether it's heartburn or constipation or diarrhea. So make sure your patient understands that you want to know all of the medications they're taking rather than just something prescribed for a stomach issue. For kids, of course, there are going to be a few differences in the questions you ask. First of all, you're probably asking the parents for those younger kids instead of asking the child themselves. One aspect of this history taking that might need special attention is that nutritional assessment. For infants, of course, we'll be asking whether they're breastfeeding or formula feeding, if they've introduced solid foods, what kind of foods. As the child starts to get a little bit older, we can ask if there's any concerns about picky eating or any kind of food allergies developing. And then when you get into the adolescent patient, remember that adolescents are now starting to make more and more of their own food choices. So it's an important time to make sure that the adolescent understands basic nutritional concepts. We can also become more diligent in our screening for eating disorders as our patients hit that pre-puberty into puberty growth stage. Another thing to remember is that it can be difficult to tell when a young child is in pain, especially if they can't talk to you. You will have no way of the child telling you straight out that they're in pain. So we can educate parents about watching for pulling knees up to the chest, or grunting from pain, or even just guarding the abdomen. And if they report any of those behaviors, then we can assess more carefully for an underlying abdominal problem. Finally, don't forget that obesity is growing in prevalence in our younger patients, so we need to ask about activity patterns as well, exercise, how much time they're spending playing versus on a screen. And of course, that nutritional assessment plays in here as well. Lastly, for our older adults, this is already going to overlap things we've talked about either in these videos or in prior lessons. So first of all, remember your instrumental activities of daily living. Make sure your older adult is capable of buying their own groceries, preparing their own meals, and then feeding themselves as well. Or if they're not capable of doing that, making sure that they're set up with the appropriate resources to help them. We also want to ask about basic diet. This becomes more important the older your patient gets, because older adults are at a higher risk of a nutritional deficiency, whether it's related to financial constraints after retirement or physical constraints with preparing and eating meals. So making sure that your clients are eating an adequate diet is important. And then again, remember that a lot of our older clients are taking more medications, so we need to assess for those effects and side effects. And then again, that constipation is more common in the older adult, so making sure you screen specifically for those bowel habits. Okay, so now that we're done with that, it's time to move on to video number 3, where we'll begin discussing gathering our objective physical exam data.